You made it to the Go Commando Show with Fred Galvin. On our new mission, we contend with the naked truths of health, leadership, and overcoming adversity. Now it's time to Go Commando.
Good afternoon, Commandos. We have an exciting show for you today. We have with us Dr. Sandra Billinger, and she is a physical therapist who went on and also got her PhD, and she is a fellow of the American Heart Association. She is an associate professor here at the University of Kansas Medical Center in Kansas City, Kansas, and we are going to be talking about much of her research. So she not only is a professor, but she conducts research, and she's the director of the REACH lab, and we're going to be talking about the specifics of that. So without further ado, welcome to the show, Sandra.
Thank you very much. Appreciate the opportunity to be here.
Yes, we are excited. Now, this is an area that is very important for everyone that listens to the show because cardiovascular disease is the number one killer of, at least for Americans. And what led you to get into the field of physical therapy and then researching vascular issues?
Well, originally I was a dental assistant, and so I was loving my job. And unfortunately, in 1993, a car accident changed my life, and I could not go back to that profession. When I was in high school, I either wanted to be a dental assistant or a physical therapist. And so my first route was the dental assisting, and so I feel kind of lucky that I got to go and pursue another career. So after my car accident and after a couple of years, I decided to go back to school. Fort Hays State University, which I'm from Hays, was getting a physical therapy program. And to me, that was really exciting to try to pursue that. When I was working on my undergraduate degree, the department chair of the program was very interested in stroke and exercise. And so that's how I got interested in working with people with stroke.
So you studied this, but then you also practiced as a physical therapy, and then what led you to become a researcher?
So as I was also working in cardiac rehabilitation, which is where I got a lot of experience working with exercise, which is very important in preventing heart disease, and working with people on their way in recovery after a heart attack. So I had a lot of experience in exercise and cardiovascular disease, and when I started working with the stroke patients, which that adds a layer of complexity, they typically have cardiovascular risk factors such as high blood pressure, and we were looking at studies because exercise after stroke was really, really unique. And as I became more interested in that and we were presenting our findings from his work, it became very clear that I really loved research. And the chair of one of the departments there just took me aside and said, "Sandy, you're a researcher. You really need to pursue a PhD."
I see. And so that was the aha moment for you, pretty much, when you decided instead of working one-on-one with individuals, you wanted to solve a larger, complex issue that could be applied through many physical therapists. Is that correct?
That is true. So while I was doing my undergrad, I had not yet become a physical therapist. And so, but I was getting a lot of experience related to exercise, cardiovascular disease, people, post-stroke and how they present. And so then I just continued to look for a PhD program that was tied onto a physical therapy program. And so I ended up at KU doing a very unique program, and that is your joint PT and PhD. And so the idea is that, yes, I can work with patients, and that is very exciting, and I was very motivated to do that. But also research can help inform our clinical practice, and that's really what I was interested in.
Yes. And having worked with a lot of physical therapists on my own particular issues, there's a large range of mobility issues that a physical therapist can work with someone on. And what led you to focusing on the issue specifically around the heart?
I just, if you want me to be honest, the heart is my favorite organ. I love it. I think it's just rhythmical. But I think it's because it influences so many things. If your heart's not pumping correctly, or if there's damage to it, or if you have high blood pressure, a lot of things can really happen. If we think about the heart, it's not just the heart, but the vessels that carry the oxygen-rich blood that is just so important to our organs and our muscles. And now we even understand how important it is for brain health. So I think for me, the heart is at the center of everything. And then, thinking about blood flow and delivery after that is, I think, why I've stayed in that area, because it's just so important.
Yes, and could you briefly explain to the listeners how large of a problem we currently have with cardiovascular disease in America, and how any particular reasons why we've gotten to that state in America?
Well, as you mentioned earlier, cardiovascular disease still remains the number one killer in America. And really, this is all of the risk factors such as high blood pressure, diabetes, high cholesterol, high glucose levels. And then there's the role of genetics. But, those are the risk factors and things that we can control. And so when we think about that, really understanding our risk factors and trying to stay active. A lot of people, our jobs nowadays, we sit more often, as we're doing here today. We're sitting, but most of our jobs are in front of a computer. We don't have the manual labor that we did once upon a time. People are really good at fixing us. The physicians can, we're just getting better and quicker. And so people are living with heart disease or the effects of heart disease longer. And so I think that's a lot of it. In addition to our diet, not getting enough sleep, not understanding what our numbers are, not going to see the doctor.
Yes. So Commando's pay particular attention to what she just said as far as the sleep and the diet and, being able to move and, being sedentary. There's not often some of these warning signs, but that's why we're tuned in here today to understand a little bit more about how serious of an issue this is. And Sandra, when does a typical American start to notice that they may be having a vascular problem, and how does that manifest itself?
That's an interesting question. And, if you're not going to the doctor, then you may not know. There are really no symptoms of high blood pressure. Most people will never know if they don't go to the doctor. There was an interesting article that came out just today, actually, that I was reading, and I didn't get all the way through it, but it was talking about how, cardiovascular disease is no longer an older person disease, but that we're seeing the symptoms and the signs of cardiovascular disease younger and younger. And so, it can start as early as 20 years of age, with the obesity epidemic. And certainly looking at our youth and making sure that, we're encouraging physical activity. And just like you said, physical activity, eating well, making sure people are sleeping, maintaining mental and physical health is just all important. And so, seeing those numbers in the early 20s is a serious problem.
And there are some who can look completely healthy, and they may even be on a regular exercise regimen and be eating somewhat healthy diet, but they could be at risk. Is that correct?
Yes, I mean that can certainly be. I've certainly known people that maybe through their life they didn't have good healthy behaviors, and maybe they didn't exercise, but the doctor said, okay, we need you to be healthy, and maybe they're exercising now and eating well, but they've still had a lifetime of not doing that. So just because you're exercising, don't think that you're not at risk, because you can. You could have plaque buildup that maybe you don't know, or if your blood pressure's too high. And then there's family history. So it's really important to understand, if your mother, father, a first-degree relative has had a heart attack or died from a heart attack, that increases your risk. And so, again, understanding that and making sure you're going to the doctor and having those checkups is extremely important.
Yes. And for those listeners, most are not medical professionals, but they're interested in your research. And can you dive in and provide an overview in layman's terms as far as looking at the cardiovascular and the neurological when you research? How are you actually doing that?
So there's, most of my research is in people with stroke. That is really where I've started and where it has been in looking at cardiovascular risk factors. An area that's really fascinated me is, as I've mentioned, I've really studied the heart in people with stroke, but I've had a really unique opportunity to work with our KU Alzheimer's Disease Center. And we're really looking at people, their vascular health, and what that looks like related to brain health. And that is a big interest right now, as we know Alzheimer's disease or vascular dementia continues to be a problem. With that, we are using, kind of high equipment such as transcranial Doppler ultrasound. We look at blood pressure. We're measuring the blood flow. So if you feel on your head here at your temple, there's an artery that actually runs through here that we can measure the blood flow to your brain. And so we do that both at rest and looking at how the blood flow delivery is, and then we have people exercise, and we can look at the change in their blood flow to their brain with exercise. And we're trying to understand if that is lower than maybe other people, what risk factors do they have, and can we look at ways to modify that so we can improve their brain health?
Yes. In several, and for the listeners out there, we will have the banner, and if you're just listening, you may want to go to the YouTube website or to the notes so that you can see the links that Dr. Sandra Billinger has done a lot of this research on, because she is very well acclaimed and has done numerous research. She's just too modest to mention any of that, but her website will elaborate on the specifics of much of this research that she's been involved in for many years. But if you could talk about some of these research projects that you've been involved in and how exercise or lack of it affects the mind.
So I was part of an exercise trial. Again, it was with the KU Alzheimer's Disease Center, but they were really looking at, they've had two NIH-funded projects. One was looking at people who are older adults, and they put them through this exercise program. And what they found is that those people who exercised at the higher than the recommended minutes, so we're recommended to get 150 minutes of moderate intensity exercise. That's what the American Heart and a lot of different organizations recommend.
Per week?
Yes, 150 minutes per week. Of moderate intensity exercise or 75 minutes of high intensity exercise. But in this study, they were getting either 75 minutes a week, 150, or I believe it was 220 minutes per week. And then they had a control group that was not doing any aerobic activity. And so what they found was that over time, the people who exercised at the higher dosages, the more exercise they got, they actually had some improvements in their thinking abilities, which is very important. And these were older adults. And so to see that change is really important. I think on multiple levels, exercise can benefit our brain health from a vascular perspective. And that is something that we're trying to look at in people with stroke, because now you've had vascular damage in different areas of the brain. And right now we're doing a study where we're looking at people within 3 months of their stroke and trying to look at that vascular health and how they respond, and does that relate to their walking and also their thinking ability.
And just so for my own clarification, you say at the higher end, is that higher end of intensity or duration?
That was duration, yes, thank you. That was minutes per week. And so in that study, it was a continual increase. It started out at lower amounts, and then they increased over time in this 6-month period.
Yes. And so, as we've both stated, the number one killer of Americans, regrettably, is cardiovascular disease. And many Americans have known a loved one who may have had a heart attack, and not quite as many may be familiar with a stroke. So for those that know a little bit about a heart attack, as far as a buildup inside those arteries of some low-density lipoprotein, that plaque, can you explain in layman's terms so that listeners can understand what is going on when a person's leading up to a stroke and has a stroke, and the different types of strokes that someone may have?
Yeah. So you can have what's called an ischemic stroke. And what happens is that there's either a blood clot or something like cholesterol or something that's built up in the artery that blocks the artery, just like a heart attack. In fact, we try to get people to think of a stroke as a brain attack because blood flow is not getting to areas of the brain, and so it's blocked off. You can also have a hemorrhagic stroke where, the vessel ruptures or bleeds and ruptures, and then there's blood that's going into the brain. This is typically the result of high blood pressure. So maybe the artery wall is weakened, and then that ruptures, and then you have blood in the brain tissue. How people might know that they're having a stroke, this is something that we call FAST, and this is face, arm, speech, and then time, which means we need time to get to the hospital. So for face, you might see if you have them smile, maybe their lip will droop. If you hold the A for arm, if you have them hold their arm up, hold both arms up, and if one arm can't raise as high as the other, then that could be maybe a stroke. And then speech, if you ask them a question and they say something that doesn't make sense or they can't form words, that's also a sign that they could be having a stroke, as well as being dizzy, maybe loss of balance. I hear a lot of my patients after stroke would say, well, my arm felt numb, and so I just went back to sleep thinking that my arm had fallen asleep, but really those were early signs of stroke. So just being aware of all those signs and symptoms is very important. And if you're having any of those, it's important to seek treatment immediately.
Yes, and again, I'm trying to prompt the listeners because she's done so much research in this field. And for those stroke survivors, what would some of those regimens include, to get back into as healthy a state as possible? What can someone do with the exercise diet, and what would some of the general suggestions be without prescribing something?
Right. One of the most important things that people can do after stroke is reduce your sitting time. And this is really, really important. Even if you can't exercise in a formal way, if you're sitting watching TV, making sure that on the commercials you're standing up, maybe if you use a chair to sit in, that maybe you stand up and sit down regularly. Just doing whatever you can to move more often. If you're going to the refrigerator, maybe taking a couple of laps around the house. If you can't get out a lot, maybe you have balance issues or just aren't able to get out of the house. But trying to be active within the house is really important. There's numerous studies that show that people after a stroke are far less active than their age-matched peers, same age. And so it's really important. As far as diet, again, reducing the processed foods and going out to eat and trying to incorporate healthy vegetables and fruits is really important as well. Yeah.
And I saw in the lab here, it's a nutritional assessment. And so they are, I'm assuming, able to look at someone's baseline and see if things can be adjusted and put them in a better condition as far as what they're eating or their nutritional intake. Is that correct?
Yeah. So, you would have to look at for a registered dietitian, but certainly they can definitely help with that. They're part of our School of Health Professions, the Department of Dietetics and Nutrition, and so, they talk with people and help them with nutritional advice. And so, yeah, absolutely. You can talk with a dietitian, a nurse, a physician, and really, really try to get at your nutritional health. And I think another part that's really important after stroke is really make sure you're taking your medications. If the doctor prescribes cholesterol medication, blood pressure medication, making sure that people are taking that, because that's going to help control those numbers and keep you healthy long after you've had your stroke.
And what are the general age ranges? I'm sure there's a certain category where it's most prevalent, but there's also what's the earliest that somebody may end up having a stroke?
Since I started my research, which was in 99 to 2000, typically we saw 75 years of age, and then as we started doing more and more research, that age was getting, 62 and 60. Then we started seeing 45 and 50, and now we're seeing as early as 20. And so that's concerning. A lot of it is centered around lifestyle choices, and that's physical inactivity. Again, being overweight or obese, not eating appropriately is also a big factor for that.
Do you think that may have been that we weren't in the past looking for stroke victims or stroke patients at that early age, or is it that we're looking for it now, or is it just actually shifted left and becoming early?
Yeah, no, it's definitely that people are having it early. It's really, because a stroke is such a, you may have minor symptoms early, but if you have a stroke, you really know. I mean, part of your body is, you either can't talk or you can't use your arm or your leg. So if they go to the hospital, we are documenting it. And it's not to say that somebody in their 20s didn't have one. It's just we're seeing it more often in our younger people. And so again, it's very important to educate our audience and talking to family members and encouraging children to be physically active, playing on the playground. Kids should be playing at least an hour a day. Making sure they reduce the computer time, the time in front of the TV, and really trying to maintain that activity level. Certainly good sleep is important for our overall health. If we're not sleeping enough, then, our cortisol levels rise, which is bad because that's your sympathetic activity. Your heart rate stays higher. You don't really relax when you're sleeping if you're not getting good sleep. And again, our diet is just so important. I can't emphasize all those enough.
Yes. And so when someone moves into these at-risk categories, I would assume that it's important not to just, you mentioned medication, and a doctor is normally prescribing that, but if they're at a severely at-risk state, they should be following a prescription that includes a physical therapist, putting them onto a regimen that gets them moving. And you mentioned, there's like a team approach with a dietitian and also the medical doctor. How important is that to combine efforts and have a team approach to stroke survivors?
Yeah. First, whether it's heart attack or stroke survivors, that team approach is crucial and very important because everybody has a role in that. So, yes, the physical therapist will work on, balance or walking or, getting out of the chair. An occupational therapist will work on return to work activities or household activities, such as dressing themselves, getting to the bathroom, bathing, those types of activities. The physician's going to lead the team, making sure that they're medically stable when they leave the hospital, prescribing, as you said, the medications, which are important for them to take. There's always a nurse manager that's going to oversee everything, follow up with appointments, and give education materials, things like that. And certainly dietetics and nutrition, helping with the nutrition piece. So it is essential that there's a team approach with that.
Yes. Now, I also read about your REACH lab. If you could briefly talk about what the REACH lab stands for and is, and how also it's not only for patients who've had a stroke, but it's also for, on kind of the opposite end of the spectrum, for athletes, and you do some testing. Can you talk a little bit about that, please?
Yeah, the REACH lab is for research in exercise and cardiovascular health. So again, we're very interested in that cardiovascular piece. We do see people with stroke. Certainly we are interested in exercise, again, looking at their brain health. We do test athletes. We have the ability for the people to come and do an exercise test. So it's a little bit like what we hear with a cardiac stress test, but we're measuring the gas or the air that comes in and out of their mouth. So we're measuring oxygen that they bring in and carbon dioxide that they blow out. And we take you on the treadmill and we exercise you as long and as hard as you can, and we can get a measure of your fitness. That's one part of it. We also have a database where we're looking at getting a lot of people, young, healthy, older adults, a lot of people in our database for brain health. So we're trying to really get at how do people look when they go from rest to exercise. When you challenge the heart and the whole body, how does blood flow to the brain, look with that exercise piece? So we have a database for that. So we'd love to have people. So if anyone's interested and wants to participate, we can come and measure your blood flow and look at that. We do a lot of work centered around cardiovascular health as well. And so we look at pulse wave velocity, which, we look at the pressure that your heart feels as the heart pumps blood to the body. So we have a lot of really unique and fun opportunities for exercise. And if anyone's ever interested in certain things, we just take people's names, and if we have a study that they might be interested, we'll call them in. A lot of times we get runners when we need people for VO2 max testing or that exercise testing for your overall fitness. We get people to come in from the community and participate, and it's really been great.
I've heard these reports of, some very competitive athletes who challenge themselves, and not necessarily that they're at, a high altitude or in an enormous stress, but, just very fit, athletic people who are on a treadmill and they die of a heart attack. Is there any things to look out for those who are in exceptional health, and could they be at risk, and what should they take precautions of?
That's a little bit harder for me to answer because there's a lot of things that can cause sudden cardiac death, and that's really not an area of my research. But what I would recommend is, even though you're maybe an athlete and maybe you exercise a lot and you think you eat well, there's the genetics piece, and you still need to go to your doctor. You need to have your blood pressure checked. You need to know what your cholesterol is. And then over a certain age, physicians tend, maybe do an EKG, again, to look at the heart. So an EKG stands for electrocardiogram, and it just looks at the activity of the heart at rest. And so as we get older, we can be at risk for different arrhythmias, such as atrial fibrillation or heart block. And so a physician would want to look at that. And so if you never go to the doctor and think, well, I exercise and I eat healthy, I don't need to go to the doctor, you may be putting yourself at greater risk. And so I think my take-home message is, it's just, regardless of the activity or food that you eat, you still need to go see your doctor and make sure that you understand your numbers and get your regular checkups and physicals. Yeah.
And with that guidance, you have, done so much research, and you have examined and participated, collaborated with a lot of academic institutions all across the United States. Reading this, it's been very impressive how much time in years she spent investigating and researching all these things regarding heart health. That being said, what are some of the basic good principles that someone who, it's just past January, they want to do a resolution for good health, what should people be doing? I know you mentioned, sleep, but are there any particulars that guidance that you would give for someone to get on the right track?
I think, again, if you're not exercising, it's always good to check with your physician first and make sure that you don't have any underlying issues, health issues that might, not be, exercise might not be helpful for. So it's always important to start with your physician. Also, starting slow. A lot of people will decide that they're going to join a class and maybe it's too hard for them, or maybe it's not appropriate for them. So it's okay to start slow. And again, as I mentioned for the stroke survivors about not sitting more, sometimes it can be just as simple as, taking a break every hour from your desk at work and moving around, taking a walk with your dog or your kids, or go to the park, and just becoming more active is an easy first step to incorporate into lifestyle management. Certainly, even starting out small, maybe you go out 4 or 5 times a week for lunch or dinner at fast food restaurants. So maybe cut that down to 3 days, and then make it, a little bit later, 2 days, and try to make those small changes. Because I find when working with people that if they can make small changes to incorporate, and it becomes a habit or it becomes part of their lifestyle, it's much easier for those to change. Other than, well, I'm just going to eat healthy every meal. That may be a little more challenging, but making those small changes really do add up over the course of that year. And, again, people always want to lose weight. That's the number one. I want to be active and lose weight. And that takes time. I remember somebody telling me once, because after my car accident, I couldn't exercise. I couldn't do anything just from some of the injuries. And I put on weight, and the doctor would always remind me that think about how much time has passed since you were healthy and how that weight came on. It's going to take just as long to come off. It's not going to happen overnight. It's not going to happen in a week or two, but it's actually better if it comes off slowly because it's easier for you to maintain. So just being sensible, I think, is really an important message, and going slow.
As you mentioned, in regards to challenge, you accepted a self-initiative of your own challenge back in 2013. Sandra wanted to increase awareness, and she set some goals, and her son walked across the entire width from west to east of the state of Kansas, 570 miles. And you really, that to me is a big sign. It's one thing to mention verbally, educate folks, but to actually, show through, 1 foot in front of the other marching. As a former infantryman, I can understand going through those paces, and it's really a testament to yourself. And you raised, your goal was $50,000. How did that raise awareness, and what did it personally do as far as in your own life in increasing awareness?
Yeah, that was a really unique challenge. So, as I mentioned at the beginning of the interview, in 1993, I had this car accident. What I didn't mention was that I was pregnant with my son when I had the car accident, and so he was born premature, and so he and I really have been close over our lifetime, and so he was just finishing junior college here in Kansas City, and was going to move back to Hayes to finish his degree. And so as I thought about it, it was actually 20 years, almost to the date, as he was finishing up, since I had my car accident. And he and I got to talking, and this was, he was thinking about taking a man journey and walking across the state, and I thought, there is no way he's going to make it across, and hopefully he will never listen to this because he'd deny. But he really wanted to do this. He enjoyed walking a lot, and so he wanted to do this. And so I said, it's been 20 years since my car accident, or the car accident. Why don't we do this journey together? May, it was when we were going to start, is Stroke Awareness Month. Why don't we use it as a way to educate people on the importance of physical activity? And then at certain towns, we met up with different stroke groups and did education where we could on the importance of physical activity. We talked about the research that we were doing. As I mentioned, the brain blood flow, where we look at the brain blood flow in the artery, we needed this very specialized equipment. And so we decided to make it a fundraiser and share what we wanted to raise the money for and what this research would look like and what our goals were for it. So we got dropped off at the Colorado-Kansas border, and then we followed the Santa Fe Trail. There's actually a trail that goes all the way from one end of Kansas to the other, and it follows the Arkansas River. And so we walked across the state following that trail day in and day out, and walked across and had a very interesting time doing that. A lot of fun stories along the way. But the goal was really to educate people about the awareness of physical activity while we were raising funds for this equipment, with the hopes of really impacting our knowledge on brain health and how can we, avoid the vascular decline after stroke, and then also then looking at brain health. And we've actually been able to expand it into Alzheimer's research with our KU Alzheimer's Disease Center. So it's been really, really wonderful. And a true testament to the people of Kansas for, they'd make sure we were doing okay when we were out there. People would stop, ask if we needed water, that would see us walking, but also donating and believing in us and donating for that equipment so that we can make a difference in the lives of our people. So for all those who may be watching that donated, I know we've said thank you before, but again, thank you for following us and helping us with that and educating yourselves and trying to keep us healthy.
And how long a period of time was that from one side of the state until you reached here in the eastern portion?
Well, I had people from Australia coming to visit, so all I had was 23 days. So that was the time that we set. 30 days would have been nice, but we averaged about 26 miles a day. Our shortest day was 22 miles, and our longest was 46. And that was really hard. And it really was. It was that day-to-day without any resting. We couldn't rest because we had to get back. And so that was the hardest part. But yeah.
Thank you for putting your money where your mouth is. And
yeah.
For the commandos out there, what incredible tribute and story. Here's someone that is helping people every day on such a vitally needed subject with your heart health. And, she is not only preaching, to get out there and move. She went on a trek across the entire width of the state of Kansas. And for those of you who know your geography, it's one of these long, wide states. So, everything she had mentioned is very important, and it's changes that I here in this last year have taken to heart as the reason that it's led me to University of Kansas is because my cholesterol was high, and her expertise is not just helping myself singularly; it's everyone out there that is able to understand that. Look, as she mentioned, check your numbers, go to see your doctor. Become aware of what your numbers are, what they mean, and how, if you're at a risk, how to develop a plan like she did with her march. She had set these goals, and she knew how to, continue on and progress to accomplish that long-term objective. And that's something that I had personally done, and it does, as she has recommended, it involves your sleep, involves your nutritional intake, making sure that it's balanced, and knowing your hereditary, limitations that you may be challenged there, and then developing that long-term plan, and along with your doctor, getting those routine checkups, because this is serious business that you don't want it to go too far, and many Americans just don't know until it's just too late. You always hear the commercial about carrying some aspirin because. But that's not the situation you want to get into. You hopefully can look forward, get checked, and move on. So that being said, thank you so much, Sandra, for meeting with us and for your great research. You are truly an inspiration to myself and many others, and we hope that listeners will take it to heart and apply what you have said and go get checked out and live a better quality of life.
Yeah, thank you very much. It's been a real honor to be able to share information with you and the listeners out there. I certainly take care of your heart, take care of your brain. We always say what's good for your heart is good for your brain. So just making sure you're doing all those things to stay healthy, and wish everyone the best in 2018.
Hi, Commandos. I am here at the University of Kansas Medical Center, and this is the REACH Lab. So Dr. Sandra Billinger, who we just interviewed, she has set up a study that I participated in that is measuring the blood flow in my brain. So this recumbent bike that I am on, I just finished a test. There was other devices strapped to me to measure my blood pressure, and it's on a different screen out of view that is your EKG. But as you can sort of see when you're exerting, that one screen behind is measuring the brain blood flow, and that's measured through these devices, a transcranial Doppler system that projects it on the screen, and they are collecting a lot of data to hopefully in the future be able to do things like Dr. Billinger had mentioned as far as why she raised the funds for this bike and this study to assist people with cardiovascular disease, specifically for brain and stroke survivors and those who are trying to prevent that. So it's a very interesting study. Incredible crew they have here at the Kansas University Medical Center, and they're doing great work. So if you are interested in doing a test, please contact Dr. Sandra Billinger's office at Kansas University Medical Center at the link that we'll have here on the show, and come down and help them finish their study. Thank you, Commandos. Have a great day.
To all my fellow grunts out there who in your youth felt it was your duty to protect us, I salute you. And thanks to the listeners of the Go Commando Show who labor on the farm, who are sweating on the construction site, putting forth your very best at the office. You are making a difference. Support the Go Commando Show in our pursuit of bringing you the highest quality professionals. Infiltrate the website at gocommandoshow.com, where you can view all of the podcasts and arm your team with incredible deals on health supplements, commando clothing, and equipment. Every time that you get a good deal, it supports the show. What deals? When you purchase anything from the website, Amazon, healthcare supplements, you're covering our six. And to the ladies on the team, when you outfit yourself in the super sexy threads from Naked Zebra, and yes, I'm talking about in a fuego, you are firing the sniper shot for our commandos. How else can you support? It's simple. You smash the follow and subscribe buttons on our social media. That is how you support us bringing great guests to talk about serious subjects, not the mainstream media's fake news. So thank you, and until our next show, stay in the attack and go Commando.